Hi, I'm David Poe from Clinical Edge, and welcome to this week's 5-minute physio tip on what's the best way to treat tight muscles. Like me, I'm sure you get lots of patients coming in saying they feel really tight and sore in different areas. For instance, their traps. I've got really tight and sore neck and traps. So the question is, do you reach for the massage cream, give them a massage and get stuck into it straight away to help to release it, or what's the best way forward? Well, you've got another option which can work just as well, if not better, and works better in the long term as well. So if your patient's reporting tightness, one way of getting some increased muscle length is with strengthening. And there's been a recent study with Bourne et al. 2016 in BJSM looking at hamstrings. So they checked fascicle length of the hamstrings, and we know there's an increased risk of hamstring muscle injury with short fascicles. And so what they did is they got people to perform strengthening of the hamstrings over a 12-week period, and they assessed fascicle length and also their strength as well. And what they found was that over 12 weeks, from performing concentric, eccentric hip extension and also Nordic hamstrings, they compared that to a control, that they got increases in fascicle length and also got change in their strength as well from performing both exercises. So we know that we can improve fascicle length, so muscle length, via exercise, including concentric, eccentric exercises. So that gives us some really good ideas that for muscles that feel tight, maybe even they are tight, we can get improvements in their muscle length from strengthening. So how does that help you with your patient that comes in with tight traps? Well, you can incorporate some strengthening into their exercise program. Undoubtedly, people are using their traps for all sorts of activities throughout the day, whether that be carrying the shopping bags around, or whether it be doing anything else. You have to use your traps. So if we can make your traps more resistant, stronger, more able to cope with your activities of daily life, then they're less likely to feel tight and sore because they're overloaded. So there's some really nice trap strengthening exercises that help to target your trapezius instead of levator scap. Anne Cools and her group in Belgium performed a great study looking at EMG levels in traps compared to levator scap, and found that if you perform your shrugs with your arms out to the side, 45 degrees, and perform your shrugs in that way, that you train more of your traps compared to your levator scap. The other way that you can do it is overhead, so you can hold weights over your head and perform shrugs overhead as well. So that's a really nice way to increase your strength in your traps and also increase fascicle length. And right now you might be just thinking, well, if I train them, they're just going to get tighter, right? Well, it doesn't seem to work like that. I had a patient in just recently that he had some hitching of his shoulder, and when you palpated his traps, they were incredibly tight. We strengthened his traps. We didn't do any soft tissue release on them all. We strengthened them with shrugs out to the side and overhead shrugs. And within a few weeks, his shoulder was able to relax and drop down. He was more comfortable at a longer length. And his traps, when you palpated them, didn't have that same tone in them. So much more relaxed. It's a much more sustainable way for your patients to approach their treatment, for you to get long-term changes with your patients. Saves your hands, but it also empowers your patient, gets them strong and able to cope with everything. So before you reach for the massage cream, maybe try some strengthening, grab some dumbbells, TheraBand, water bottles, whatever it might be, and get stuck into some strengthening to lengthen. All right, have a great week. See ya. If you've caught us anywhere else besides on our blog, we're over at clinicaledge.co. We've got lots of great webinars, podcasts, videos, all sorts of clinical resources for you there. Come and check us out. I look forward to seeing you there.